Thank you for joining us for the first of a series of webinars that we'll be presenting throughout the year. The American School Health Association is the only organization that addresses multiple disciplines in school health and that is devoted solely to school health. Our membership of approximately 1,000 individuals represents school health as administrators, counselors, dietitians, nutritionists, health educators, physical educators, psychologists, school health coordinators, school nurses, school physicians, and social workers. We're the proud publishers of the Journal of School Health, a premier journal in the area of school and adolescent health. If you are a member of ASHA, you can elect to receive a hard copy or electronic copy of the journal. The price of membership is inexpensive, and for the price of admission, you receive the journal, access to our bi-monthly e-newsletter, School Health Action, and a free, free continuing education hours through webinars such as the one we are presenting today. So please consider joining, volunteering, and becoming a member of the ASHA community. You can visit us at www.ashaweb.org to learn more. As I mentioned, the continuing education credit for today's webinar is free for all members. If you are a non-member and you'd like to receive a continuing education credit for this webinar, we require a payment of $30. After the webinar, you can receive one Category 1 continuing health, or excuse me, I've lost the acronym, check for InCheck, and one CPE, or a certificate of attendance for 70% or more participation today. Participation is measured by the amount of time the webinar remains active on your screen. Please join us October 9th through 11th for the 88th Annual School Health Conference in Portland, Oregon. This year, we've partnered with the Oregon School-Based Health Alliance, and we hope you'll join us for what will be an invigorating and resourceful conference. Registration will open in early May, so we hope to see you there. We have two exciting webinars in May. The first webinar focuses on the Smart Snacks Initiative in schools presented by the USDA. The second webinar is centered around the new sexual health education standards that will be published in the June issue of our Journal of School Health. More information and registration details will be posted on our website, which is ashaweb.org, shortly. I want to remind everyone that your microphones are muted. However, we encourage you to post questions in the question box. So let's get started on today's webinar. We're delighted to have Bridget Borgogna from the CDC presenting training tools for healthy schools, promoting health and academic success. Bridget is a health education specialist at the Centers for Disease Control and Prevention's Division of Population Health, where she serves as a project officer and manager for the Training Tools for Healthy Schools Professional Development Contract. She is a member of the program and professional development team and provides expertise and technical assistance for professional development internally and with external partners. Bridget was a health and physical education teacher and worked at the Georgia Department of Education as the state's Safe and Drug-Free Schools and HIV Prevention Coordinator. She also was an international master trainer for the Lions Quest program, as well as for her own training and consulting business. She earned her Master of Education degree from the University of Buffalo in Buffalo, New York, and a Curriculum and Supervision certificate from the University of Georgia. So welcome, Bridget, and I'm now going to turn it over to you.
Wonderful. Thanks, Jeannie. And I'd like to also thank Abby for your background work in helping setting up the webinar. And as Jeannie said, I'm Bridget Borgogna with the Division of Population Health in the School Health Branch. I'm delighted that all of you were able to join us today to learn more about the tools that we have developed and offer to school districts across the nation. I'll give you a very brief snapshot of how the tools have progressed since their insemination in 2007. By the end of the presentation, you'll be able to identify the 4 training tools and what each tool can do to help schools promote health and academic success. The Division of Adolescent and School Health, known as DASH, established a training network called D-Train in 2007. At that time, the training network consisted of a cadre of 30 master trainers who provided free, in-depth training on DASH's tools to school health professionals. The focus was on 3 tools: the Physical Education Curriculum Analysis Tool, or commonly known as the PE-CAT, the School Health Index, known as the SHE, and the Health Education Curriculum Analysis Tool, known as the HECAT. In 2011, D-Train transitioned to Training Tools for Healthy Schools, Promoting Health and Academic Success, or TTHS for short, which now resides in the Division of Population Health's School Health Branch. And in 2011, 3,341 teachers were reached. The promotion of health and academic success also became more of a focus in 2011 because schools play such a critical role in promoting the health and safety of young people and helping them establish lifelong healthy behaviors. Research also has shown that school health programs can reduce the prevalence of health risk behaviors among young people and have a positive effect on academic performance. The academic success of America's youth is strongly linked with their health. Health-related factors such as hunger, physical and emotional abuse, and chronic illness can lead to poor school performance. Health risk behaviors such as early sexual initiation, violence, and physical inactivity are consistently linked to poor grades and test scores and lower educational attainment. For more information regarding health and academic success, you can find it on this website, and you will be given all of the websites that we will visit today. You will be given those, the site, the actual address for the site so that you can go in and look at all of these sites. So again, here you can find additional information on data and statistics on the link between health and academic achievement, the association between school-based physical activity, including physical education and academic performance, as well as school connectedness. The School Health Index and HECAT were both revised in 2012. In addition, the School Health Guidelines, or SHG, were introduced as another tool to help schools create environments supportive of students' efforts to eat healthy and be active by implementing policies and practices that support healthy eating and regular physical activity, and by providing opportunities for students to learn about and practice these behaviors. Other actions in 2012 that affected the training tools included revised materials for trainers and participants, expanded workshop follow-up, and we also added new trainers to the national training cadre. So let's take a look at each individual tool, starting with the School Health Index, or SHE. The School Health Index is an online self-assessment and planning tool for schools focused on improving health and safety policies and programs. The School Health Index was developed by the CDC in partnership with school administrators and staff, school health experts, parents, and national non-governmental health and education agencies. The goal of the SHE is to help schools identify strengths and weaknesses of health and safety policies and programs, develop an action plan for improving student health, and to engage teachers, parents, students, and the community in promoting health behaviors. Two things that are really important to know about the SHE is that it uses a team approach. We do not want individuals to be completing the School Health Index. And the School Health Index also helps to improve school health policies and programs. The 6 health topics The SHE addresses are physical activity, healthy eating, tobacco use prevention, unintentional injury and violence prevention or safety, asthma, and sexual health, including HIV and other STDs, and pregnancy prevention. So we have a snapshot of the website, and because we can't go live on the website today, I just wanted to give you an idea of what you will find when you look at this website for the School Health Index. So there's an introduction page. It's on the left navigation in the purple box. You will see here the 6 health topic areas the SHE currently addresses, and what the SHE is and what it is not. You'll also see the 8 SHE modules that are structured around CDC's 8-component model of coordinated school health. And then on the instructions page, it will show information for trainers, including step-by-step instructions, and also a training manual that is also available to download. The manuals, the majority of the items are identical. You will see up towards the top in the left-hand box, it says to download the entire SHE. There's a SHE for elementary schools and a SHE for middle and high schools. And so the majority of the items are identical. There are a few questions that are targeted towards school level. For example, in the elementary SHE, there are questions about recess and hand washing. And in the middle school and high school SHEs, there are questions about tobacco cessation services. And then on the next slide, it will show you how to register for the SHE. So you will go into where it says Enter SHE, and you'll notice the registration button under registration, register a new team. So you'll fill out the form to create your team. And you'll be emailed, usually very quickly, you'll be emailed a reference number, but most definitely within 24 hours. And it's very important for you to keep up with this number, as you will need it whenever you access the SHE online. And remember to share this reference number with other team members as well. There's also where it says About the SHE. There are frequently asked questions that I would highly recommend to read those if you are interested in completing the assessment online. On the next slide, it's just a typical day in an elementary school. Many school districts have found that starting with the School Health Index will give them the foundation from which they can then effectively implement the other tools. As the School Health Index identifies the strengths and weaknesses of a school's health and safety policies and programs, and it allows school teams to develop an action plan for improvement since it's implemented as a school team. Northern Kentucky Independent District Health Department used the School Health Index with 4 schools, 2 elementary, 1 middle, and 1 high school, to assess and measure progress for improving school health programming, policies, and environments related to tobacco use, prevention, nutrition, physical activity, and injury prevention. Each school focused on improving 2 behavior areas. Data collected over the past 2 years indicated that across the 4 schools, there were 9 policy changes and 12 environmental changes. Considering this pilot and program that was so successful, the Northern Kentucky Independent District Health Department expanded to 4 additional schools in 2013. Other successes that we can highlight include schools moving healthier options to the front of the lunch line, as you can see here, and increased time for PE, and a school also started a staff and student walking club. And another school also replaced fried foods with baked items. So let's pause and do an exercise on what you learned about what topics are addressed in the School Health Index. So I'm going to give you a moment to look at these health topics and decide which ones are included in the School Health Index and which ones are not. And in a few seconds, we'll highlight the ones that are not included. Okay, Abby, let's show them. That is correct. So the correct responses are physical activity, healthy eating, tobacco use prevention, unintentional injury and violence prevention, asthma, and sexual health. The others are not part of the School Health Index. So now let's look at the next tool, the School Health Guidelines. Many school administrators find the School Health Guidelines to be extremely beneficial to review and implement. The School Health Guidelines is a resource developed by CDC scientists in collaboration with specialists from universities and national, federal, state, and local health and education agencies and organizations. Although the School Health Guidelines is a resource, we have included it as the newest tool in our Training Tools for Healthy Schools suite of workshop offerings. The SHG is based on an in-depth review of research, theory, and best practices in healthy eating and promotion of physical activity in school health, public health, and education. The School Health Guidelines outlines 9 school health guidelines and strategies as the foundation to develop, implement, and evaluate school-based healthy eating and physical activity policies and practices. The full report is accompanied by an extensive introduction that describes the health benefits of healthy eating and physical activity, as well as current recommendations for these practices. While the goal is for schools to address all 9 guidelines, every guideline may not be appropriate or feasible for all schools to implement. This is why it is important to carry out the School Health Index to identify current strengths and weaknesses and develop a plan for improvement. Individual schools should determine the highest priority guidelines based on the needs and available resources of the school. And so you see the 9 guidelines listed here on the slide. So on our next slide, you will see another snapshot of a website, and this is the School Health Guidelines website. So here you can see the full report. It's the MMWR. You can download that as well as the executive summary, as well as presentation materials. There are public use presentation materials available here, and these are CDC cleared talking points so you can feel confident that your presentation is scientifically accurate. You can also, this is a really neat feature here, you can download a graphic to promote the guidelines on your own website by using the HTML code on the How Can Your School Support Healthy Eating and Physical Activity. Find out more. And that is over to the right. And then here you can see all 9 guidelines, and you can click on each guideline and it will take you to that guideline and you can find out more about each one. It will summarize, the highlights. Okay, let's do another exercise now. This is actually a live poll, and it's a multiple choice. So if you would read these questions, and then on the next slide there will be a drop down and you will be able to actually take the poll live. So here you go. Choose all that apply to the School Health Guidelines. And we'll give you about 10 seconds to do that. Okay, Abby, you can reveal the results. All right. So the guidelines, it does serve as a reference guide for physical activity and nutrition in schools. Wonderful, 100% accurate. It also helps schools identify evidence-based strategies to improve nutrition and physical activity for students. It provides scientific support and rationale for school policies and practices specific to obesity prevention. And actually, the only incorrect response is that it serves as a tool to help inform sexual health and tobacco prevention policies and programs. So that is the only, that second one there, sexual health and tobacco prevention policies, that is the only one that is not covered in the school health guidelines. All right, good job. Let's check out the PECAT now, the Physical Education Curriculum Analysis Tool. This was our first tool that we developed, and again, it is commonly referred to as the PECAT. The PECAT is a self-assessment and planning guide developed by CDC to help school districts and individual schools conduct clear, complete, and consistent analysis of written physical education curricula based upon national physical education standards. The results of the PECAT can be used by school districts and individual schools to enhance existing physical education curricula, develop their own curricula, or select published curricula that will deliver high-quality physical education to students that meet the school and community needs. The PECAT uses a team approach just like the School Health Index, and it also helps school districts and individual schools identify changes needed in locally developed curricula. The PECAT also assesses how closely physical education curricula align with national standards for high-quality physical education programs. The PECAT analyzes content and student assessment components of curricula that correspond to national standards for physical education in 4 different levels: K through 2, 3rd grade through 5th, 6th through 8th grade, and 9 through 12. So let's look at a snapshot of what the PECAT website looks like. Again, in the box towards the top, towards the right-hand side, you can enter the PECAT online. You can download a print copy. You can order print copies here. And there's also a PECAT brochure. You can do the PECAT online, and that is down towards the bottom of this page. And just like our other 2 resources, tools, there are additional resources and frequently asked questions. And then there is a before you start. So the before you start and frequently asked questions, I would recommend that you start there. Now, just like, and if you go to the next slide, oh, okay, go back. Yeah, so if you go into the, if you can go back to the website snapshot. So if you go into enter PECAT, again, just like the School Health Index, you'll be mailed a reference number, again, usually pretty quickly after you register, but definitely within 24 hours. And again, please remember to share the reference number with others who will be using the PECAT online. Again, it's very, very important that schools do this as a team. Again, keep up with this number because you will need it whenever you access the PECAT online. Again, I mentioned that it is, you can download the PDF file. And a couple things that we learned from a workshop in Indiana. They reported several successes. One in particular, it helped the physical education department teach similar lessons and curriculum after they attended a PECAT workshop. And it also helped them to make clear, distinctive goals to work towards. And someone said in the evaluation, after leaving the workshop, they felt like they were ready to develop a curriculum if needed. All right, let's move on to our final tool, and that is the Health Education Curriculum Analysis tool. This helps school districts, and individual schools conduct a clear, complete, and consistent analysis of their health education curricula. The results of the HECAT can be used by school districts and individual schools to, just very much like the PECAT, improve an existing health education curriculum, develop a health education curriculum, or select a published curriculum that will deliver high-quality health education to students. The HECAT is based on the National Health Education Standards and CDC's characteristics of an effective health education curriculum. And again, just like our other tools, the HECAT uses a team approach, and it can be customized to meet local community needs. So let's look at what the website will look like and what you can find on this website. Again, like all of the others, you can download a brochure. There are frequently asked questions. You can also click on the National Health Education Standards and CDC's characteristics of an effective health education curriculum to learn more about both of those. There is also guidance on using the HECAT on all of the templates, and you can find that here. And again, you can download individual chapters of the HECAT. On the next slide, you will see, again, here's the HECAT cover and general instructions, the overview. So there are lots and lots of downloadable PDFs here that you can use to help you develop a curriculum, assess what you already have, or look at an already published curriculum and see if that will reflect the needs of the school and the community. So the HECAT covers 10 modules, and it covers alcohol and other drugs, healthy eating, mental and emotional health, personal health and wellness, physical activity, safety, sexual health, tobacco, violence prevention, and comprehensive health education. And again, there are just so many resources that, that you can get here on the HECAT website. All right, we are ready for one final activity. So this one is a true or false. So if you would look at these four questions here and decide whether they are true or false. And we will then reveal which ones are true and which ones are false. Okay, yes, the first one is true. And the second one is true. And the third one, just like the sheet and the PECAT, it is most effective if you complete this as a team. Okay. Unfortunately, okay, here we go. All right. My computer just went off. Okay, here we go. So we have a new tool here, and it is the Comprehensive School Physical Activity Program Guide. And this was just developed recently. And although it is not in our suite of workshops that we have as part of the Training Tools for Healthy Schools workshop, it is one that will help schools to look at physical activity and physical education in a comprehensive manner. So, and I'm sorry, mine is, my website is down, but I will get that up in just a moment. If you can go, I think there is a visual on the next one. Yes, here we go. Okay, here is the website for our Comprehensive School Physical Activity Program. Again, you can see the guide over to your right, and you can download that. I do want to mention that CDC, in collaboration with the American Alliance for Health, Physical Education, and Recreation, which is now known as SHAPE America, they helped us with the guide. And as you can see, the goals of a comprehensive school physical activity program are to provide a variety of school-based physical activities to enable all students to participate in 60 minutes of moderate to vigorous physical activity each day. And again, it also gives you information to provide coordination among the comprehensive school physical activity program components to maximize understanding, application, and practice of the knowledge and skills learned in physical education, so that all students will be fully physically educated and well equipped for a lifetime of physical activity. And if you would go to the next slide. And this is a wonderful visual showing the gold standard to provide a variety of school-based physical activities to enable all students, again, like I mentioned before, to participate in 60 minutes of moderate to vigorous physical activity each day. And you can see that part of the Comprehensive School Physical Activity Program includes staff involvement, family and community engagement, physical activity during school, before and after school, and the center is quality physical education. All right, thank you. And let's now talk about the training cadre. A national cadre of master trainers provides workshops on using and implementing our tools. The training cadre now consists of staff in 17 states, and you can see that on the map where the current national trainers reside. New national trainers were added to the cadre 2 summers ago after attending a 3-day workshop to become qualified to deliver their selected training tool. And then on the next slide, you will see an attractive brochure that was developed for distribution to potential school districts and workshop attendees. So this brochure describes the training tools for healthy schools and the availability of workshops. And again, this can be downloaded from the website. And let's look at the next slide. And this is the other side of the brochure explaining the 4 tools. So workshops on using and implementing CDC's school health tools are available upon request. So if we do visit that website, do we have a slide with the snapshot of the website? There we go. So again, it goes through the 4 tools that I just explained, and you can click on each one of those, and it will take you directly to the site. You can also download the brochure from this website. And let's go to the next one. And this is where you can actually download the workshop request form and complete it, save it, and then send it. And we will look at the workshop, we'll look at your request, and fulfill it if possible. And I'm going to talk about that in just a moment. Again, just like the other websites, there are frequently asked questions. All right, so let's talk about some follow-up activities after the workshop. So we did expand our follow-up activities in 2012, and it was designed to measure the impact of these trainings. So the workshop coordinator, that's the person requesting the workshop, they work with CDC to begin the process of obtaining important information about the use of the training tools for healthy school tools. The CDC would like to be able to measure the impact the tools are having. Also, CDC wants to determine how to better market the value of the School Health Index, the PECAT, the HECAT, and the School Health Guidelines to different schools and partners. So I'd like to share a couple things that, some comments from workshop participants. Some workshop participants for the PECAT, they said that using the PECAT will ensure that they are preparing a sound PE curriculum for their school. They loved the workshop and they'd like to see a follow-up session and perhaps a check-in on progress. Again, they loved the workshop and the instructor. We do have an excellent cadre of trainers out there. And then a couple things that they have said about the School Health Index. They thought it was an excellent training and that the CDC materials were well designed and helped them to keep on target, especially time-wise, but it still allowed for discussion and extra activities. And there was a nice group dynamic during the workshop. The workshop also allowed for networking and hands-on work with the School Health Index. And some of the participants in the HECAT, they are using the materials to first revamp the current curriculum and then to evaluate it. Really important step. Another person said that they will use the national standards more often in the planning for lessons and they'll put more focus into using the HECAT characteristics as a guide. And then a few comments about the School Health Guidelines. They love the time on all of the topics. They thought it was a wonderful workshop. They loved the resources and the activities. And they always like to hear how other schools have implemented health-related policies and programs. And that actually does happen during a School Health Guidelines workshop. So I'm sure now you're wondering, well, who should attend a workshop? How much does it cost? And how are workshops approved? So we can go on to the next slide. So who should come to a workshop? Well, anyone who works on school health issues, and this might include school administrators, health educators, physical educators, curriculum specialists, government agency staff, university professors, professionals, community volunteers, and others who work with schools. How much does a workshop cost? Well, that does depend. Training requests are reviewed, then a determination is made. So the cost of a workshop can range anywhere from about $1,500 to $2,500. Workshop coordinators are responsible for funding and securing workshop logistics, including the facility. They are also responsible for downloading and printing workshop materials. And they are responsible for the trainer's honorarium for his or her time and expertise, as well as the trainer's travel expenses, which would include airfare or car, hotel, and per diem. Workshops are approved based on the readiness of the school district and having a minimum of 10 participants up to a maximum of 35 participants, depending on what tool is being requested. So if you'd like more information, please go to the website and send an email with your question. So speaking of questions, we can open this up for questions and answers.
Okay, Bridget, we have a question from Kim Gwynn. Will there be a new version of the SHE with CDC endorsing the whole child model with a new coordinated school health approach with ASCD?
Well, there are talks of that. There is nothing concrete at this time, but that question also just reminded me when you asked about updating. I did want to mention that the PECAT is now going through we're just starting a revision right now with PECAT, but I believe that there will be talks to then, better align our tools with the whole child model down the road. And of course, as funds are available.
Okay, we have another question. I had heard that there are no longer trainers available for the HECAT. Is this incorrect?
That is incorrect. We have many HECAT trainers available. And if there is someone that would like a workshop, a HECAT workshop, please send an email on that TTHS website, and or you can send that to Abby. Abby will get that to me, and I can give you a list of our HECAT trainers.
Okay. Is the CS PAP training available to organizations yet, like the other trainings?
Well, although that is not part of our training tools for healthy schools, that's a great question. Yes, we are currently rolling out the Comprehensive School Physical Activity Program training to some of our funded partners. And it is also available through Let's Move Active Schools. And again, I can get that contact information to you so that you can contact LMAS, Let's Move Active Schools, and they can get a trainer in your state. And there currently are some state trainers for Let's Move Active Schools out there. And the Comprehensive School Physical Activity Program is part of that training.
Okay, and one more question. How do you become a trainer?
Well, at this time, we are not taking any more, we are not expanding our training cadre at this time, but I will be happy to get your name and contact information from Abby to keep in our files. And when we would think of expanding, we would let you know.
Okay, if anybody else has any questions, you can submit those through the question panel on the right-hand side of your screen. All right, it doesn't seem like we have any more questions, so I want to thank Bridget for presenting on, training tools for healthy schools, and I also want to thank Jeannie Alter, our board member, for moderating the session. If you have any additional questions, please email them to info@ashaweb.org, and I will send those on to Bridget for her response. And this webinar will be posted on our website in the next couple of days, so everyone will have access to the presentation. We'll also send you a follow-up email after this webinar so you can complete a survey. You have to complete the survey if you want continuing education credit. And we will also include a PDF copy of this PowerPoint for attendees. So again, I want to thank Bridget and Jeannie, and I think we're good.
All right, thank you, Abby.
All right, everybody have a good day.